Good morning, everybody. My name is April Kane, and I am the Director for the Western Pennsylvania Regional Response Health Collaborative Program. I welcome all of you here today to our crisis management briefing. We know that taking care of ourselves and supporting our colleagues are very important aspects of managing the COVID-19 pandemic. We are so glad that you're here today to join us in this crisis management briefing to learn more about normal reactions to stress, healthy coping strategies, and how to foster personal and organizational resilience. This program is being brought to you here today in partnership with the Allegheny County Health Department and UPMC Western Psychiatric Hospital's Critical Incident Stress Management Support Team. And we are so glad that you're here with us here this morning. Again, my name is April Kane, and I am the Project Director for our Western Pennsylvania Regional Response Health Collaborative. I am also the Co-Director for the RAVEN initiative here at UPMC, which is a CMS demonstration project. The Western Regional Response Health Collaborative has come to be through the efforts of the state of Pennsylvania wanting to provide COVID supports to our long-term care facilities here in the state of Pennsylvania. They have passed in May of 2020, $175 million signed by the governor for a budgetary period of July 1, 2020 through December 1st of 2020 to provide focused supports and services to long-term care facilities. The long-term care facilities that are covered under this initiative are assisted living, personal care homes, and nursing homes. The state split our state into 6 distinct regions. UPMC, along with Allegheny Health Network, the Jewish Healthcare Foundation, and the Healthcare Council of Western Pennsylvania, in addition to our regional health partners of Excella Health, St. Clair, and Penn Highlands, are supporting nursing facilities and assisted living facilities in southwestern Pennsylvania, as well as the bottom tier of the northwest section of Pennsylvania. As part of our role here at the Regional Response Health Collaborative, we do have a 24/7 call line. We are supporting our facilities we support them in their universal testing efforts, as well as infection control assessments and supports and guidance. We have also been providing crisis support related to PPE and staffing needs as they arise here for our partners in Western Pennsylvania. Our Healthcare Council of Western Pennsylvania do assist us with further PPE assessment of our needs here in the region, as well as having key forums of discussion with our partners. And the Jewish Healthcare Foundation have been providing us additional supports and webinars for our partner facilities. But here today, we wanted to take specific time to focus in on the behavioral health and support needs that are needed during this time for all of you. So we are going to have a presentation here initially started by Dr. Kristen Mertz from the Allegheny County Health Department, and she is going to go through some initial information about the current status of COVID in our region, and then we will have our partners from UPMC Western Psychiatric Hospital further move on into the crisis management briefing program to talk about effective coping skills and resiliency. Dr. Mertz?
Thank you, April. I'm just gonna, and thanks everyone for joining this morning. I'm just gonna give you a few statistics to show where we are in this pandemic. You probably have heard that in Pennsylvania, we have over 150,000 cases and over 8,000 deaths now. In the southwest region of the state, we've had over 21,000 cases and over 600 deaths. And then in the northwest district, we've had close to 4,000 cases with 98 deaths. But the thing that's relevant today is how hard long-term care facilities have been hit by the pandemic. In the Southwest, we have over 2,700 residents and 850 staff that have been affected in long-term care facility with 480 deaths, and that's 76% of all deaths in the Southwest region is associated with long-term care facilities. And in the Northwest, we've had 474 cases, 297 staff, and 66 deaths. And that's 2/3 of all the deaths in the Northwest District are associated with long-term care. So the burden in long-term care has been extremely high. And in addition to the known burden of COVID, we recognize that the unknowns about COVID and the uncertainty of what the future holds for COVID is also adding to the stress on healthcare workers and other long-term care staff. And the difficulty of doing an already hard job is compounded multifold by the pandemic. There's the added tasks of caring for ill residents, trying to protect other residents and staff from getting sick, and the endless documentation and reporting requirements. And then despite all these things, we've seen some amazing work that staff are doing to control the virus and end outbreaks in their facilities. But all the stress and long hours can take a toll, and we think it's really important to recognize that that it's important to encourage staff to seek support. So the objective of this webinar is to share a variety of resources with staff who might be able to benefit. So thanks for joining, and I'm going to turn it over now to Jeffrey McGill from UPMC Western Psychiatric Hospital.
Good morning, and thank you, April, and thank you, Dr. Mertz. And I want to begin by thanking all of you for your time today in allowing us to present this crisis management briefing. My name is Jeff McGill, and I am the co-manager of the Critical Incident Stress Management Support Team at UPMC Western Psychiatric Hospital. I, along with other members of our stress management support team, will be presenting to you today a crisis management briefing. This crisis management briefing is designed for you, our healthcare team members at our long-term care and skilled nursing facilities impacted by COVID-19. And as we heard from Dr. Mertz, those numbers are quite alarming. The goal is to provide tools and resources to help manage the stress impact that individuals and organizations have experienced over the past months related to COVID-19. Today's crisis management briefing will address the following: stress reactions, coping tools and wellness approaches, resources of support, and organizational resilience. I want to begin by saying that our support team is deeply saddened by the toll COVID-19 is having on our long-term care and skilled nursing facilities. We know that individuals in these facilities, due to their age, health conditions, and communal living status, are among the most vulnerable to get sick and even die from this infection. I would add that the stress toll that this pandemic has had and continues to have on all the members of the healthcare team is great. It's estimated across the United States as much as 35% of all deaths associated with COVID-19 have been in our nursing and long-term care facilities. And you heard as we started this from Dr. Mertz in the local impact here in Southwest as well as in Northwest regions, and the impact specifically to our skilled nursing facilities and long-term care facilities is great, unfortunately, as well. As a result, we recognize the impact this pandemic has had on each of you, and we want to make sure that we're doing our part to support you through these difficult times. During this pandemic, healthcare team members were often the only support as family members and loved ones were not able to come to the facility to have in-person visitation. Family members would ask the healthcare team members to be at the bedside of their loved ones and to support them both in their physical as well as their emotional care needs. The cumulative stress, both professionally and personally, have left you, the workers within our long-term care and skilled nursing facilities, with a great need for support. It is our shared hope that today's briefing can help engender and enhance individual and organizational resilience as you restore to adaptive functioning into this pandemic, and that it aids you as the healthcare team members in your journey of wellness and stress management. As stated, the impact of this pandemic on you, the members of our healthcare team, are very much noted. So to begin to discuss the range of impact, I'm going to now turn it over to Kelly Mullen and Dr. Amin.
Thank you, Jeff. My name is Priyanka Amin. I'm a psychiatrist at UPMC Western Psychiatric Emergency Services. As Jeff has stated, we're really grateful to be here today to be able to talk to all of you, and we really appreciate all the work that all of you have been doing in caring for individuals in long-term care settings. We know that unlike other adverse events that we've experienced at work, or in our personal lives, the COVID-19 pandemic has been quite unusual and extraordinary. It's been going on for months, and we're not sure exactly when it's going to end. And that makes being able to cope pretty challenging and different than other challenges that we faced before. We also know that all of us are trying to manage personal and professional stressors and maintain work-life balance while doing the best we can to put on a professional face and care for individuals, while also having our own stress and anxieties back at home. We hope that this presentation will be helpful for you. So with that said, we're going to be talking about some different common stress reactions. And one thing we know is that the intensity and the duration of an exposure in terms of a stressful event can lead to more prolonged or stressful or intense stress reactions. And again, this is one of the ways in which the pandemic is different than a one-time acute adverse event. It is normal to have these different stress reactions. This is the way that our brains, our minds, our bodies are all trying to cope with what's going on and make sense of it. We want to mention that, if these reactions are starting to interfere with our quality of life, we really recommend that folks reach out for additional support, and that right now it is normal to need additional support. And we'll be going over that a bit later in the presentation. So first, we want to start off by just going over different common stress reactions that can occur in response to a stressful event. And for that, I'm going to turn it over to my partner, Kelly Mullen, to talk about some of these domains. Kelly?
Hello. As Dr. Amin has said, my name is Kelly Mullen, and I am the program director of our long-term structured residential program at Western Psychiatric. And I'm going to talk to you about the emotional responses that can happen when you're in a stressful event. And I'm going to start with fear. One of the things that can happen is when we can feel fear. And the things through this virus is we can feel fear of getting the virus ourselves, fear of giving the virus to somebody else, fear of losing an individual to the virus that we're caring for, a family member, or a friend. You may be feeling guilt. Maybe you're feeling guilt that bringing that virus home to a loved one. Maybe feeling guilt of being able to go home to family members when the individuals that you work with aren't able to have family members come see them. You may be feeling a lot of anxiety. And this anxiety may come from not knowing what to expect on your upcoming shift. You may feel anxiety due to changes within your family systems, such as childcare needs and/or financial strains due to your partner being laid off from their job, or needing childcare due to your school district doing virtual learning. You also may be feeling anxiety with not knowing how long this pandemic will last. You may be feeling anger. This anger could be towards your family and friends who aren't feeling safe to be around you for fear that you may be exposed to the virus because you work in a long-term care facility. You may feel angry towards your coworkers who have taken a leave of absence due to having a pre-existing condition, or towards peers who have been calling off, leaving you to pick up extra shifts. You also may be feeling angry at yourself for choosing a job that you aren't able to work from home during a pandemic. You may be feeling sadness from the loss of individuals you've worked with, the loss of seeing friends and family, and the loss of normalcy. You may be grieving these losses during this time. We often don't acknowledge that we are grieving. Next, I will talk about possible cognitive responses. You may be having intrusive thoughts. This is very normal, especially when you maybe have been working with individuals who've had the virus and watching them go through that illness and afterwards having intrusive thoughts on how that virus impacted them. You may be experiencing hypervigilance, being on edge, startling more easily. You may be experiencing memory problems, having a harder time recalling what happened recently. You can be experiencing changes in perception of time, things feeling like they're taking longer or time going really fast. You may also be experiencing a decrease in concentration. You can go to the next page, please. The next behavioral thing we're going to talk about from a stress reaction perspective is our behavioral responsive we may be experiencing. You may be feeling like you're more easily agitated, more irritable by things that usually don't bother you. This would be very normal during these times. You're having increased in interpersonal conflicts, both on the job and in your personal life. You're noticing that your sleep patterns have changed. Maybe you're sleeping more or sleeping less. You're noticing an appetite change. You're feeling like you're more hungry or you're less hungry. Another common behavioral reaction is you may be experiencing an increase in alcohol use. Before I turn this over to Dr. Amen to talk to about two other behavioral stress reactions, I'd like to thank you all very much for all that you do. Dr. Amen.
Thank you, Kelly. So I'm going to be talking a bit about the physical reactions that you might be experiencing as well as the spiritual ones. In terms of physical reactions, we know that when we're going through these stress reactions, we might be finding ourselves feeling, really tired. We might be having some stomach upset, feeling nauseous. As Kelly mentioned, some folks have trouble with sleeping, and so having a harder time being able to fall asleep. In those moments where we have spikes in terms of our stress reactions, we might notice that we feel dizzy, we might get tunnel vision, we might even find ourselves having a higher heart rate or feel our blood pressure going up. Some people might notice that they're sweating or that they're even grinding their teeth more during the day or at night, or feeling like they just can't quite catch their breath. Headaches are another common physical symptom that we might be experiencing as part of the stress reaction. There are also many spiritual stress reactions that folks may be experiencing. So if for those that believe in a higher power or in God, those individuals may be finding themselves feeling very angry at their higher power or at God, may even be experiencing a crisis of faith or pulling away from the practice of their faith, as well as pulling away from their faith-based community. Some people find that they may be getting visions or having different thoughts about religion. In terms of the more spiritual aspects, people do find sometimes that they're having a disruption of what the meaning of their life is, finding themselves feeling hopeless or more helpless, finding that they're not trusting people as much as usual, not having as much faith in individuals, and also feeling just alone and really isolated during this time period. So the reactions that Kelly and I covered, we want to share again, are all part of the normal realm of what can happen in response to this ongoing stressor. And we want to leave you with the message, which is that healthcare workers, we know that are facing these stress reactions can actually go on to recover and may even thrive afterwards. We know that the responsiveness of organizations and specific agencies has a very strong impact on what ends up happening to folks in terms of their recovery. And that's why our team's very grateful to be able to be here for you all today. I think that shows an organizational strength in terms of your long-term care facilities that they're allowing us to help provide this material to you. We encourage you to use the different tips and resources that are included. And we also want to mention that prioritizing your own health and well-being is really instrumental to continuing to provide excellent care to individuals. We know that everyone on this call is doing the best that they possibly can, and we are so grateful for all of you who are working in long-term care facilities. Now I'd like to turn it over to Jeff McGill and to Dan Lichok to talk about different coping skills and wellness tips.
Thank you, Dr. Amin, and thank you, Kelly. As healthcare team members, we know you face extraordinary times, including high work demands, challenging personal and professional stressors, and even pressure to find that healthy work-life balance. If you're like me, most of us are creatures of habit, and we love familiarity. What we know about COVID-19 is it really has pushed us all outside that range of our typical day-to-day experiences, and likely has probably led to feelings of a lack of or a loss of control. Dan Litchuk and I are going to talk about the importance of focusing on some coping and wellness tools to help you regain a sense of control. As you heard from Dr. Amin and Kelly, there's a range of stress reactions that you likely have experienced. All of those are quite typical. But we want to talk now about how we're going to cope and how we can manage those from a wellness perspective. So we're going to begin to talk about the ways you can support yourself. So on the handout before you titled Coping and Wellness, you're going to find many recommendations. We're going to highlight just a few of these, but understand all are meaningful. As you heard previously, stress often manifests itself in the form of fear and anxiety. This can be the result of a lack of information, maybe even rumors or misinformation. And we certainly know over the past 6 months or so, there's been a lot of information out in our media. We would recommend that it's vital for us to truly understand the risk, to be informed, and to be certain we get the facts from trusted sources. It is all of our responsibility to stay up to date on what is happening while trying to limit the amount of time and exposure we give to media. Following credible and factual sites can really help reduce anxiety while keeping us informed. We know that this pandemic is continuously evolving. How we manage things in the workplace may also evolve over time and circumstances, so having the facts, staying informed will really help reduce that anxiety, as I mentioned. We encourage you to follow truthful and factual sources like the UPMC COVID-19 page to stay informed about healthcare, and also stay connected to the County Health Department, the COVID-19 website for current and local updates. Next, we're going to encourage you to speak up. I think it's really important that we advocate for our needs. And certainly events such as this pandemic can leave us feeling helpless, maybe even powerless due to the loss of control that we have. It's important to have a regained sense of control, which can occur by speaking up and being your own advocate. Ensure that you have what you need to feel comfortable, advocate for yourself, your patients, your family, your loved ones, etc., in their overall needs. Also, to address feelings of being helpless and powerless, we can feel more comfortable by staying connected with our supports and connections. There's been so much focus around social distancing. And certainly while social distancing has shown to limit the exposure risk and to reduce the transmission of this disease, it's vital, and I can't emphasize that enough, it truly is vital that we stay connected with others. Consider, generally speaking in life, when bad things have happened or when you've experienced stressful times, who in your life do you turn to for those supports? Who are your support networks, both in the workplace and outside the workplace? You want to identify those individuals and reach out to them. Now, certainly we may not always have the ability to connect in person, but you want to be able to connect with them, even if it means through our media and social media outlets. It's okay to share openly with your support network, your concerns and how you're feeling. You want to maintain those healthy relationships. So use those social media platforms like Teams and Skype and Facebook and all the others that are out there that you're maybe more comfortable with in connecting with your supports. And you can do this while still maintaining that social distancing. This allows your supports to be a healthy distraction from the stress of COVID-19, which can add a sense of normalcy and familiarity in these very trying times. The other thing that I would encourage is that when you're connecting, it's okay to talk about things other than COVID-19. It's okay to talk about other aspects of interest and likes and things that you're doing to still stay connected while not always having to focus on COVID-19. Additionally, I would just say having a positive attitude or outlook can really help us navigate these trying times. I encourage you to hone in on your glass is half full attitude. And there's been a lot of research out there that talks about our perception of stress. So maintaining a sense of hope and positive thinking. Consider those aspects of your life that you do have control over, those that allow you to feel less helpless to them. Consider that phrase mind over matter, and it can certainly be helpful in providing a sense of control once again. And what I said earlier, having the research that supports having a positive attitude. When we're faced with stress, I think we can all associate those people in our lives who we consider to be Eeyores, those that the moment they feel or sense stress, they already feel defeated. But the appraisal of that situation, to be able to look and say, although it may not be ideal, I'm going to take this straight on, or I'm going to take it head on, and we, if you will get through this. That positive thinking can really do a lot to help our resiliency. Next, I'm going to turn it over to Dan Litchok, who's going to discuss how best to support others, including your family. Dan?
Thank you, Jeff, and thank you for everybody else. Like it's previously stated, my name is Dan Litchok, and I'm one of the senior crisis trainers for the Crisis Training Institute and the co-coordinator of the ASAP team at Western Psychiatric Hospital. I wanted to take a couple minutes to be able to talk to you about how do we talk to others during these stressful times. As you can see on the handout there, the first part is talking about, you know, the people that you work with. Not to add any more chaos or stress or workload to your plate, but a lot of times coworkers reach out to each other to discuss various aspects of their life, their job, the stress of it, and we wanted to kind of be able to give you the skills to effectively listen to your coworkers and be that level of support with as little amount of work coming from you as possible. In the first and foremost, we just want to be able to listen to our coworkers, to be able to hear how the stress of the virus, the stress of their job, this, you know, all the different stressors in their lives and how it's affecting them. To take the time to just sit back and listen to what they're saying, to see how all of that stuff affects them, to see how well they are coping with their stress or how well they're not coping with their stress. At no point in time should we ever think that we have to be the fixer of our coworkers. A lot of times our coworkers just need to be heard. We don't often have a lot of good individuals in our lives that truly listen to us. And if you could be that individual that listens to your coworkers and provides that help and support, sometimes that's all your coworkers really need, is just somebody to listen to them. When you are listening to them, try to be empathetic with the things that are being told to you, because being able to put ourselves into the shoes of our coworkers and see the world through their eyes and see how difficult the world is, how stressful the world is, how stressful work in their home life and the juggling of all the different responsibilities that we all have now that the virus has made an impact in our life, allows us to be empathetic to our coworkers. And that level of empathy allows us to do one thing that for another human being that is truly remarkable, and has to be able to validate them. To be able to sit back and listen to your coworker and have them tell you how difficult and stressful their life is, and for you to be a little bit empathetic and see the world through their eyes, and then turn around and say something to them along the lines of, that's really difficult for any one person to handle. You must be very overwhelmed. Something as simple and easy as that is an opportunity which now allows your coworker to recognize the fact that you actually did hear them, that you were paying attention, and that you do care about them and the stress in their lives. Again, we never really want to try to fix the individuals. We just want to be a help and a support. If an individual or coworker really needs to be quote unquote fixed, well then there are resources within the community, and my colleagues here today are going to tell you about some of those different resources that might help get your coworkers in the direction of somebody not necessarily fixing, but making things better for them. Which falls in line with the next bullet point there is really just involving the others. You know, if there's people within your organization that are a help or outside the organization, involve as many people as possible so that you and your coworkers are functioning at your top capabilities. Once we have kind of sat down and listened, if you're the person that had the opportunity to be listened to, every once in a while it's nice to get a little bit of a check-in to make sure that you're still doing okay. So if we are those individuals providing that help and that support, a regular check-in, and I'm not saying it has to be every half hour or hour or but just recognizing that the person reached out to you at a time of need, and we want to be able to just kind of follow up and see, do they still have that level of need? Is that need there, or has it subsided, or has the needs gotten worse? Because if the needs have gotten worse, then we really want to be able to refer that person to somebody that can actually help. When it comes time, you know, not just due to our work families, but we also have our home families that need our help and support. So make time for your family. And I know everybody says, well, my family comes first, and I try to make as much time for them as possible. Try to make a little bit more, because they need you just as much as your coworkers, and then the individuals that you serve at work need you. But when you make that family time, make it time that is engaging, not just sitting there staring at a screen. But, you know, maybe it's going for a walk. Maybe it's sitting around the table and playing cards and having conversations about, you know, how are things going for you today at school, or how are things at your job, or you know, maybe it is playing a board game, or you know, doing some mindless activities that you guys can have conversations that are meaningful conversations, not just the fluff situation of, you know, the weather, how was your day, and then just moving on. Making sure that your family members are also taking care of themselves, because we need to be able to take care of ourselves. If we can't take care of ourselves, we can't care for others that need our help. You know, and maybe you might be that person that needs some help from one of your loved ones at home, and if they can't help you out because they haven't been caring for themselves too well, now you have two individuals that are needing some help without any great abilities to care for themselves. You know, a lot of times just getting outside and getting away from the different distractions that we see on the TV, through our cell phones and our tablets and social media and all the different emails and everything else, being able to shut off those distractions and just getting outside and doing activities with your family outside are great activities that brings everybody together and brings a great close bond with each other. So now I'm going to pass it off to Dr. Roselle, who's going to continue the presentation. Thank you.
Thank you very much. And on to the correct screen. Yep, that's the correct screen. Thank you very much. So my name is Jack Roselle. I'm a psychiatrist, and I'm the medical director out at Resolve Crisis Services. And I'm going to talk to you for a couple minutes about some of the other resources that are out there that you can reach out to and that you can call. You know, as Dan mentioned, having someone to talk to, being able to listen to someone, is sometimes one of our very best interventions at a time of crisis, at a time of disaster, and having that trusted person there that you can speak with, or that can listen to you, or that you can listen to, can be a really valuable process. But we also appreciate that there's lots of times and lots of situations where there may not be somebody around, right? We may know that we're off shift, and that if we call that usual person we go to, we're going to wake them up and during their precious sleeping time. We may have had experiences, things we've seen or heard or been through over the past months that we may not want to contaminate other people with. We don't want to sort of put the stuff in their minds that they hadn't had to experience themselves. Sometimes we know we need maybe a little bit more than just listening. We might need to link into some of the resources. Maybe we want a little bit of privacy. We want that to be our own special space to communicate and think about what we need to do. And that's a good time to think about reaching out to any of a number of different great crisis resources that are out there. And I'm going to go through about half a dozen great resources. You can see them on the screen. It's in a handout that's been distributed. The type's a little bit small on the screen, and so the numbers can be a little tough to read. I will repeat the numbers, but again, they are in the handouts and they're very easy to read there. So the first is the National Suicide Prevention Lifeline, which is the official national network of crisis lines, about 180 different network hotlines, including our own Resolve Crisis Services here in Allegheny County, but spread across the country. And when you dial the number, which is 1-800-273-8255 or 1-800-273-TALK, you'll be routed to whatever the right local crisis center is that knows your region and knows the resources. And even though it's officially labeled the Suicide Prevention Lifeline, really they're available for any crisis. And all of these centers, just like our own here in Pittsburgh, very much go by the adage that we want you to call before a crisis becomes a crisis. And so if you're feeling maxed out, if you're feeling overwhelmed, or that you're about to be overwhelmed, that's the time to, hey, I'll pick up the phone and get a little bit more support, or just vent for a little bit. Again, the number is 1-800-273-8255 or 1-800-273-TALK. And this is a resource that's available 24/7, 365. It's free, it's confidential, and you'll be able to link to a trained professional for added support. There's another resource called the Disaster Distress Helpline. Like the National Suicide Prevention Lifeline, it's run under an arrangement with SAMHSA, and it connects to some of the same centers with some of the very same training, but it's also a little bit more focused towards disaster issues. Their number is 1-800-985-5990. Again, it's available 24/7, 365. It's routed to hubs that are specially trained to deal with disaster issues. It's free, it's confidential, and it's available around the clock, not just for the disaster of coronavirus, but for the other disasters that we know are hitting across the country, whether it's hurricanes in the southeast, fires in the west, and so forth. This resource is also available by text. If you text to 66746, they will respond to you, and you can do a text support session. Or again, you can call their phone number, which is 1-800-985-5990. There's also a crisis text line, again, part of the same broader network, that's accessible at 741-741. Or if you go to their website, crisistextline.org, they also have a web interface. And again, it's free and confidential, 24/7 support available by text or online messaging. Again, the text line, it's the short code of 741-741, and you can text PA, you can text help, you can text home, whatever you want is sort of the initial message. Whatever you put in as your initial message, they will respond. It's 741-741, or their website is crisistextline.org. We have a statewide support line that's run by our State Department of Human Services, also available, 855-284-2494. It's available to assess anyone, professional or layperson, needing added support across our state during this current crisis. Again, the Pennsylvania number is 855-284-2494. Now, my colleagues, Dan and Jeff, went through a number of effective and good coping skills. Unfortunately, we know that sometimes people's coping skills turn towards substance use, and we know that that's not a very good strategy. There are very good resources available for people who are struggling with substance use issues, and it's available through a statewide point of access line through the Department of Drug and Alcohol programs, 1-800-662-4357. Again, that's 1-800-662-4357 to reach our state-run network of referrals for drug and alcohol care. You can also text their line, 717-216-0905. Again, their text line is 717-216-0905. Now, as I mentioned before, the National Suicide Prevention Lifeline at 1-800-273-8255 or 1-800-273-TALK is part of a network. And for those of you who are military veterans or served in the military, there's a special channel within that access point. When you call that 800-273-TALK number, if you press 1, you'll be routed to a specific veteran-focused crisis center. I hope these resources may prove helpful to you or those you care about. Thank you for all you have done for our Commonwealth and our friends and our families, and please take care of yourselves. Thank you. At this point, I'm going to hand this off to my colleague, Abby Bodloss, to talk about organizational resilience issues. Thank you.
Thank you so much, Dr. Roselle, for the information on the resources. And I really would encourage everybody to review and utilize these support networks, both in addressing stress related to this pandemic and in general. I know that I personally have utilized these tools in managing my own stress. So we're going to shift gears slightly here to touch on our last topic of the day, which is about organizational resilience. But before we do that, I wanted to introduce myself as a member of our UPMC CISM ASAP support team and a lead social worker here in the hospital. My primary responsibilities and focus are in our integrated health and aging program, which is specifically designed for consumers that have comorbid medical and mental health needs. And in many ways, the population of the people that we're serving on this unit here in the hospital, including their age, care needs, vulnerabilities, are really consistent with the residents that you're also serving in your long-term care settings. In my role here, I've had the opportunity to directly communicate and collaborate with many of your facilities and understand firsthand the challenges and significant changes that you all have been facing in your day-to-day work with the residents and their families. And I know my colleagues have also touched on that as well. Since we know this is the age group that's most at risk in this pandemic, we, including us here in the hospital, have had to significantly adjust how we deliver care to be more mindful and proactive in limiting COVID exposure and impact, including our own exposure and then that of our families. We also understand firsthand that it takes a village, from physicians, direct care staff, utilities management, maintenance, nursing staff, administration, activities programming, dietary, pharmacy, and I'm sure I missed a group in there. But it takes all of us working together to meet our clients' needs and keep our organizations operating successfully, even in a normal climate. As individuals working in the health and human services field, we understand that the work can naturally be stressful. We've developed our UPMC ASAP peer support program specifically as a way to acknowledge and address this within our workplace here at Western Psychiatric Hospital and UPMC wide. As a group, we often talk about the importance of resiliency in the work that we do, and we understand resiliency as the capacity to recover from difficulties. Generally, when talking about resiliency as it applies to our work, we're often focusing on the individual, again, as we have talked about earlier in the presentation. We also focus on how to build reserves before a crisis. In many ways, you've already naturally created these reserves. However, in the acute crisis and the extended precautions created by the pandemic, those reserves may be depleted or are in the process of being depleted. Yet we're still expected to model wellness and continue to serve our clients with poise and excellence, and this can be really challenging. We've already talked today about the importance of personal self-care by reviewing individual stress reactions, coping and wellness tools, and providing resources for more support. These are all very, very important tools. We're going to take it a step further to talk about organizational resilience. It's equally important in the work that we do daily, and especially during heightened stress levels created by the pandemic or other catastrophic events that we may experience at work, that we're also feeling supported by our institutions. At this point, I would normally turn the presentation over to my colleague, Jackie Lyde, who's our lead chaplain here in the hospital. She's also an integral part of our ASAP support team. She helped develop these tools with me. Unfortunately, she's not going to be able to join us today for this briefing. But I'm going to start by defining organizational resilience, discuss why it matters, and provide examples of how an organization and leadership within the organization can support staff and create a positive work environment. So what is organizational resilience? It is the ability to sustain a competitive advantage by delivering excellent performance and being able to adapt to change. Like the development of individual resiliency, an organization needs to work on strategies to achieve resiliency before, during, and after a crisis. Why is this important for us? Well, for an organization to be successful and sustainable, it needs to focus energy then in the areas that will promote this success. It's imperative for an organization, especially one focused in health and human service delivery, which relies largely on its staff to be successful, that time is invested in supporting the staff, fostering staff wellness, and promoting solidarity, especially during the pandemic like COVID-19 or again in other catastrophic events. So the question is, how then can we support